I'm Alisa Haushalter, Director of the Shelby County Health Department, and joining me is Dr. Bruce Randolph, our Health Officer. I'll give some brief updates, invite Dr. Randolph to make any comments if he would like to, and then we'll open it up to questions and answers. And we called today's press conference because we know there are a lot of questions about the wasted vaccine and some of the things that are in the media. So we thought it most appropriate to have a media availability, as we typically have throughout the pandemic, to share really what has happened within the health department, what we see as some next steps, and then obviously give you the opportunity to ask questions. But before I do that, I want to publicly thank all of the team members within the Shelby County Health Department. They have worked tirelessly for the last year, many of them without a break at all. The pandemic, as we all know, has gone on for an exceptionally long time, and we're almost at that 1 year mark. So I really want to acknowledge our staff for going above and beyond, not just for vaccine distribution, but also contact tracing, enforcement, outreach, education, and all the things that are necessary to reduce the pandemic in our community. But I also want to particularly thank them for their efforts this week, one, to elevate issues that needed to be addressed, but also for their transparency and openness to continuing to improve our services internally to better serve this community. So I want to publicly thank them for myself and Dr. Randolph and the rest of the leadership within the health department. I want to give some background facts and information from our end so that all of you are aware of what happened locally. As we went into inclement weather, it was clear to me that we likely had doses that were prepared or getting prepared for pods that could occur or were scheduled to occur during the week of inclement weather. So at that time, I began to ask very diligently, how much vaccine did we have? What was potentially out that could expire? And what were our backup plans to be able to administer that vaccine without any waste or loss of vaccine? Through that process, it was brought to my attention that there were some doses that had been wasted that were in the pharmacy. As a result of that, we did several things. One, and I'll come back to reporting to the state, but our initial focus was on how do we look at all of these expiration dates and get as much vaccine as we can out to the public, even though we were going to have inclement weather. As of today, we have been closed a total of 10 days. 2 days on the 11th and the 12th for ice, the remainder of the next week for snow and ice, and then obviously the water pressure issues. So we had an exceptionally long period of inclement weather that not only was going to impact expiration dates, but also greatly impacted our inventory. We continue to receive vaccine even during the snowstorm. Those deliveries were en route and were added to our inventory. So our first focus was try to get all the expired doses out to the public, or expiring doses out to the public before there's any waste. Secondly, to develop a distribution plan for the existing vaccine that we had, and that plan also including asking the state to stop any shipments so that we could use the inventory that we had in hand that was continuing to grow because of inclement weather. The other and more important piece was reporting to the state that we actually had wasted doses within the health department. I initially called with Dr. Martin, Dr. Fiskus on Saturday, that was the 13th, to report that we had wasted doses. I made additional attempts throughout the week to reach Dr. Fiskus without a return call. Ultimately on Friday, the 19th, I called Dr. Tim Jones and made the verbal report to him that we had wasted doses. I knew at the time of reporting that when you report a large loss of doses, there is a process or a cascade of events that occurs. And that was one, we expected that the Tennessee Department of Health would visit us. They would work with us to identify all of the root causes that contributed to that loss, as well as provide any technical assistance, guidance, or education. that's necessary to make sure that safeguards are put in place. We welcomed that team on the evening of the 19th. We continue to work with that team on the 20th, and then we have worked with that team throughout this week. And as we get towards the end of the week, what we will have in place is an agreed upon plan that allows us to work together to address any deficiencies that we had in processes internally so that we can receive vaccine in the future and distribute that in an effective manner to this community. And that's generally what will happen when an item is reported to the state. And again, we're working closely with the state on that process and have continued throughout that process to share with the state any challenges that we anticipated. And we've also made recommendations to the state. The other thing that I want to share is that on the evening of that Friday, the 19th, when the health department visited us, it was my request that we not receive any additional vaccine. I had previously made a request that we needed to not have vaccine because we had too much inventory. We knew on the 8th that we had significant inventory. In part, we knew that we were going to be vaccinating teachers soon. So we wanted to have at least 10,000 doses for teachers. And then we had inclement weather hit. So on the 19th, I did request that no vaccine be sent to the health department until we could, one, reduce the inventory and then rectify any deficiencies that we may have had in place. So that brings us to today and some of the changes that have been put in place and things that people may see moving forward. So we have agreed, it's a mutual agreement with the state that at the current time, the health department will not receive additional COVID-19 vaccine. We will continue to work with the state on any procedures we need to change within our pharmacy and within our transport system to be able to manage vaccine efficiently, effectively, and safely. And that includes the inventory management component. Additionally, the city of Memphis will assume responsibility for custody of the vaccine. That will be stored at Regional 1. And then from Regional 1, the city will distribute that to any of the pods that have sites storing that particular week. Throughout the pandemic, there really has been a partnership. We work very, very closely with all of the partners, including the city, and we'll continue to work closely with those partners. At the current time, all of the pods that were scheduled for this week will continue. There's no changes in any of those. All of the appointments will be kept. Moving forward, the appointment system may change slightly, so I ask people just during the week to be patient, and we'll determine how the appointments will be made moving forward and what role the city has versus what role the county has, and that includes the 222 shot line. But in closing, really our ultimate goal collectively is to make sure that we have sufficient vaccine within Shelby County and that we are able to deliver that to the community in a timely manner, and that needs to be a distributive model, not limited to one particular government entity, one hospital, one pharmacy, or one organization. It's really going to take all of us to get people vaccinated, and so that's where our focus is currently. So I'll leave it there, and before I open up for questions, I want to ask Dr. Randolph if you want to add any specific comments.
Good afternoon. No, Dr. Haushalter, you covered pretty much everything. I just want to tell the citizens of Shelby County that we're still committed to ensuring that their health is protected. We will continue to do what we are called to do statutorily in terms of enforcing public health measures and work with all entities, including the city and all of our healthcare partners, to ensure that the citizens receive the vaccine and the care that they need. We're committed to doing whatever is necessary to vaccinate as many people as we can, because that's the bottom line. We must vaccinate everybody. We certainly regret deeply for this event that has taken place, but we're prepared to move forward.
And Frankie, I think we can open it up for questions.
Great. Thank you so much, Dr. Haushalter and Dr. Randolph. And we will kick off our Q&A period with Bradley Broders. But before I go to Bradley, just a reminder, if you have a question, use that raise your hand feature and we'll do our best to get to you. And then when I call on you, if you don't mind, just restating your name and what outlet you're representing. Without further ado, I'll turn it over to Bradley Broders.
Thank you, Frankie. Thanks, Dr. Haushalter, Dr. Randolph, for this opportunity this afternoon, as always. Dr. Haushalter, my first question to you is, understandably, the public's pretty upset with this news yesterday. Can you address the personnel changes that were made in response to this and your message to the public about accountability and making sure this doesn't happen again?
Yes, that's a great question. You know, we're all accountable for the services that we provide to Shelby County. And so in the process of looking at what all the contributing factors were to the wasted doses, we looked at processes that also included communications. Within those processes, we looked at other procedures that were in place, written or not written, and then we looked at personnel and opted to make some personnel changes to assure that we had dedicated additional or new staff assigned to particular roles. So at the current time, we had changes in 2 key staff within.
And can you clarify the personnel changes and just your reaction? Do you anticipate you all will again be in charge of distributing the vaccines and mass vaccination sites, or do you anticipate the city will be the lead on this for the time being?
So I'm going to answer this question, but at a higher level. One of the things that's really important for everyone to know is how vaccine comes into the county. So there is a process where we partner with the state to identify allocations to various organizations, and those organizations receive vaccine directly. So vaccine can go directly, say, to Baptist or Methodist or UT. Then there's a portion of vaccine that was coming directly to the health department that we then distributed to the various pods. So that's the component that the city will take over and help facilitate the conversations on the overall allocations. We receive all kinds of other vaccines as well. And so one of the things that's important is that if there are any procedures or processes that need to change, that applies to all vaccine. So we will work on the remediation plan because it's important for all vaccines. And then we will make some internal decisions and make those decisions in partnership with the state as to when we might receive COVID vaccine again in the future. I think we're all very much looking forward to the Johnson & Johnson vaccine. The Pfizer vaccine is a very complicated vaccine. It has a lot of requirements for storage, transit, and so on, and Johnson & Johnson is much easier to manage. And so as we look to the future, our goal would be to receive vaccine again, but the exact date of that is yet to be determined.
Thank you. Next, we have Brandon Richard.
Thank you so much. This is Brandon Richard with WMC Action News 5. Dr. Haushalter, have you thought about resigning? And why should the people of Shelby County have any confidence in your leadership moving forward? And I do have one follow-up question related to vaccine administration.
Sure, that's a great question. And there's always opportunities to consider whether one should resign or not resign. So I would say on any given day, that's something I consider. I'm actually at retirement age, so that's something that I should consider and have considered. However, with this event specifically, my responsibilities as a leader are to be very transparent about what happened. And so I have made it my responsibility, and it is my responsibility to be accountable for what has occurred, to elevate to the state when I knew there was wasted doses, which I did, to work closely with the state to determine what the issues were and to resolve those issues in a systematic and organized way. And from that perspective, I believe I am doing all that I can within my role to be able to demonstrate to the community that our purpose here is to serve the community if there is an error or if there's a process that needs to be changed, that we're going to speak to that and be able to address that in an open manner. And then your second question, please.
Yeah, I just wanted some clarification on how the health department is involved with the vaccine administration now. Are you guys staffing the sites? Will Shelby.community and the SHOT hotline, will those still be ways for people to make appointments?
Sure, so those are great questions as well. So we actually have been distributing and administering vaccine through the weekend and through the week. Moving forward, as of tomorrow, we will primarily do administration, which means at a site, we would be giving the vaccine. We may also help with some of the logistics, but we won't have to store and transport the vaccine ourselves. That will be done by the city of Memphis, but we will still administer. In regards to appointments, again, all appointments for this week continue. Nothing's been canceled. We are working with partners to determine how to have the appointment system work moving forward. Is that if we're not managing the sites, it may not be appropriate or necessary for us to do all of the appointments and manage the call line. So I would ask people to just be patient and know that by the end of the week, we'll make some more formal announcements relative to the sign up Genius, which is what we use currently, or the appointment system, as well as the call-in number.
Thanks. Next, we have Catherine Burgess from the Commercial Appeal.
Hi, Catherine Burgess, Commercial Appeal. The state said that there were seven different times that doses were discarded. I'm wondering if you can walk us through those 7 instances, when they occurred and how.
Yeah, so I don't actually have all the dates in front of me. The primary dates were around February 10th or 11th. And then we had another number on the 15th, which also, as we all know, was a snow day. There was vaccines given that day, but at the end of the day, there was still approximately 700 doses left. Upon looking at all of the records, what we determined is that in the pharmacy, it had been recorded that there were some other smaller doses that were left unused at the end of either end of a day or prior to being placed out for use. And one of those dated, I think, the 3rd, but the majority of those were the 10th or later, around the time of inclement weather. There are a variety of things that contribute to expired doses. It can be that, one, they're pulled out and not used in a timely manner. It can be that they were brought back and not able to be used because of a temperature change, or that they were unused doses at the end of the day. And I don't have all of those specifics in front of me. There is a process in place for documenting that. And typically that's documented in the state database to be able to reconcile if there are wasted doses throughout the month. It usually is looked at a day-to-day basis and a month-to-month basis.
Thank you. My next question, there was a backlog of about, I think, 51,000 on February 8th. So before the snowstorm and before, I believe before the decision to vaccinate 11,000 teachers, can you tell me why there was that backlog at that particular point in time?
Sure, and so I want to make sure we have numbers that are consistent. The Pfizer vaccine comes in a vial, and typically there are 5 doses in a vial. Occasionally, one can get out a 6th dose, which was previously called a bonus dose. And based on the calculation of 5 doses per vial, that was approximately 43,000 doses. If you assume that you can always get 6 out of a vial, which is not true, you would then have 51,000 doses. At that time, if everyone will remember, we actually had originally planned to vaccinate teachers around the middle of February. And the state had given us caution not to move to teachers too fast. So we actually had that vaccine in preparation of doing the teachers on the 15th. When we knew that we could not move to the 15th, we had a meeting then, it was on the 8th, with the state, and they said probably around March 1. So some of those were in reserve to be able to vaccinate the teachers, and then others were scheduled for administration the following week when we began to have the bad weather. And then, as I said, some additional vaccine came in relative to that.
Thanks. Next, we have Jessica Gertler.
Hi. So my first question, can you confirm that Judy Martin was let go from her role? And are there any other terminations or staffing changes anticipated from your internal investigation?
So Dr. Martin, who has been our chief of nursing for many years, has decided to retire. So she's moved into retirement, and we want to acknowledge her years of service and also her dedication to this community for an exceptionally long time, but also through the vaccine distribution. So Dr. Martin is no longer here. We also, Dr. Bruce, who was our contract pharmacist, has moved on as well, and we will be looking to bring on a new pharmacist in partnership with Regional 1.
And the chain of command, when you talk about, whether it's 43,000 or 50,000, I mean, that's thousands of vials just sitting on a shelf. So who's keeping an eye on that? And why did no one question that?
So actually I did question it, which is why I knew there were 43,000 doses, is that everyone has to recognize that the pharmacy is really the purview of the pharmacist. So the pharmacist would typically take inventory and report that out. And then the pharmacy is locked so that people don't have access to those pharmaceuticals. So through this process, things that I have learned, one is that there was limited access to the pharmacy. So the ability to take inventory was challenged. So we have made sure since then that multiple people, including myself, can access the pharmacy. That's important as well. And then the other piece that we recognize is the inventory management system and data entry needed to be improved to be able to have real-time calculations of what was in inventory. But again, some of that was in inventory intentionally for teachers. Some of it was in inventory for the next week. So typically one entity should have about 20,000 doses in inventory. That would be just as a baseline, because that's things that are coming in, second doses that are arriving that may be administered several weeks out. So if you have a baseline of 20,000, then you add to that 10 to 14,000 for teachers, that's well over 30,000 doses. And then if you add the scheduled doses for the following week, that's well over 40,000 doses. We also developed a distribution plan that's in place this week to be able to administer over 40,000 doses through all of the partners. So that amount of vaccine can be moved in a week to 10 days relatively easily.
Thank you. Next is Wendy Thomas.
Hi, my question, two parts. I'm trying to understand the timeline between the February 8th when you realized that you had an excess number of doses. The health department was vaccinating residents on February 15th and 16th and again on February 20th and 21st. By my count, it's really only about 4 days that the county was not operating vaccination sites. So I'm not understanding.
So we did not operate all the vaccination sites during that time period. Particularly during inclement weather, we had a lot of cancellations. We did some very specific pods that were closed pods, like for the teachers, and that was a backup plan to use any doses that were about to expire. So we didn't run a typical schedule during that period of time.
Right, so I get there wasn't a typical schedule, but the Shelby County Health Department was running vaccinations at Pipkin February 15th and 16th. They were running them at Southwest February 20th and 21st.
Yes.
I'm not understanding how that plays into the additional doses that you discovered on the 8th.
So just for clarity, they weren't discovered. We knew that we had a large inventory that needed to be moved out to the community. We also knew that we had some doses that were going to expire because they were already prepared for upcoming pods. So we opted to have those clinics at the Pipkins site, even on the weekend during inclement weather, to try to move some of that vaccine out. But we didn't run full pods for the next week, and so that did impact our inventory significantly. Some of our pods can see up to 1,500 people a day. And so if you have 2 or 3 days where you're not doing a specific site, you know, that can be upwards of over 4,000 doses. So it's a combination of those factors over time. The inclement weather, obviously having vaccine ready for teachers and the schedule changing slightly, and then continuing to receive doses during inclement weather, knowing that we were not able to schedule additional pods. That's why we developed a distribution plan for this week that was to get out over 40,000 doses.
Thanks, and I think we have time for one more question, and I'm going to turn that to Jacob Steimer.
Yeah, thank you. Jacob Steimer, Memphis Business Journal. So this primary tray that's referred to that had most of the doses and was placed in the fridge to thaw, never left the pharmacy according to the state. Was it that this tray was placed in the fridge and then nobody was ever notified that all these doses were in the fridge or needed to get out? Do I have that correct?
So what happened is on, I'm trying to make sure I get the calendar dates right. I believe that was the 11th or the 12th. So I became aware of that particular primary tray on the 13th, which was a Saturday. Is that on the 12th, there was inventory taken in the pharmacy, and that particular tray was noted, and the date on that preceded that Friday. So either the 11th or the 10th. And so that's when we became aware that it had expired, and no, we had not received notice of that.
Okay, so, and quick clarification, this is Dr. Marilyn Bruce is who you're referring to as the pharmacist. And she, do you think that is potentially a case where she was ever intentionally hiding conditions or just never made communication that she should have?
I don't in any way believe there was anything intentional. This is a very complicated vaccine campaign, and Pfizer vaccine particularly is very difficult to manage. Temperature control, dates that it can be in one type of storage, days that it can be in another type of storage. And we had multiple batches coming in. And so my own belief is that trays were pulled for events that were in the future, and that one tray expired without notice that we needed to get that vaccine out to the public. By no means was anything, in my opinion, intentional here. One of the things I noted at the beginning is the need to really focus on processes. And some of those processes are communication, but it's also inventory management and looking very closely daily at vaccines that are out, but also not pulling out vaccine until it's time to be used. So I think there's many factors that contributed to that, and they're not limited to factors within the pharmacy itself.
Thank you, Director Haushalter. Do you or Dr. Randolph have any closing remarks?
I just want to thank you, Frankie, for hosting the press conference and appreciate everyone being here. We do recognize this is a challenging time, one for our staff and our health department, but also for our community. Our commitment is to be transparent, to own issues when they occur so that people are aware, to address them in a methodical way, and to work with our partners to serve this community. So I appreciate all of you being here to help share that message with your readers or listeners.
Thank you, and everyone have a good afternoon.
Thank you.